Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today I am going to make the last video of diabetic emergency because in first video we already studied diabetic ketoacidosis and in second video we already studied hyperosmolar non-ketotic coma and hypoglycemic coma. But today in last video, third video, we will study diabetic neuropathy and diabetic foot. First start from uh, before starting from diabetic neuropathy. If you want to watch the same topic, the third video in Urdu or Hindi, I already upload the same topic on my YouTube channel. Go and watch that video. But here we will discuss in English language because my all lecture are present in both English and Urdu and Hindi. Now start from diabetic neuropathy. Topic outline include we will study definition of diabetic neuropathy, causes, pathophysiology, types, clinical feature and treatment. First from definition. What is definition of diabetic neuropathy? Diabetic neuropathy is a nerve disorder in which nerve fiber damage due to diabetes and it is complication of diabetes. Basically, diabetic neuropathy is a microvascular complication of diabetes in which nerve fiber damage due to hyperglycemia. What is definition? Diabetic neuropathy is a nerve disorder in which nerve fiber damage due to diabetes and in diabetes due to hyperglycemia and it is a complication of diabetes. Which complication of diabetes? Microvascular complication of diabetes. This is the definition of diabetic neuropathy. Now come to the causes. There are two causes of diabetic neuropathy. Number one, microvascular disease. Number two, hyperglycemia. In microvascular disease, due to capillary damage, ischemia occur and nerve fiber become damaged. In hyperglycemia, we studied detail in pathophysiology. Now come to the pathophysiology. In pathophysiology, the most common cell in our body which damage mostly by hyperglycemia is two cell. Number one is macrophage and second is nerve cell. The most common cell, the most affected cell from hyperglycemia in our body is two. Number one macrophage, second is nerve cell. Now, when hyperglycemia occur, then there is an accumulation of glucose inside the macrophage. Due to accumulation of the glucose inside the macrophage phagocytic activity become change. Its normal function phagocytosis will be changed. Due to this, then the wound healing will not occur. Therefore, in diabetes topic, mainly professor ask why in diabetes wound healing is not occur due to hyperglycemia which change the phagocytic activity of the macrophage. Phagocytic action modify of macrophage, then wound healing not occur. Second, the second cell which affected by hyperglycemia is the nerve cell. And nerve cell in diabetes damaged by two methods. Number one, by two mechanisms. Number one, hyperglycemia. In hyperglycemia, when glucose accumulates inside the cell, they damage the nerve cell. Second, these glucose also accumulate the sorbitol inside the nerve cell. When hyperglycemia occur in the nerve cell, these glucose also accumulate the sorbitol inside the nerve cell. In black, I show glucose, but in red, in nerve cell, I show sorbitol. When sorbitol accumulate due to glucose, these sorbitol act like insulin. They cause more accumulation of glucose inside the nerve cell. In the result, the nerve cell will be damaged. This is the first mechanism. The second is capillary damage, microvascular disease. Due to diabetes, the small capillary become damaged, become rupture due to blood thickness. Then small capillary damage in result ischemia occur, and in result when there is a no blood supply to the nerve, neuropathy occur, and in result pain occur. Now in Viva, professor ask two main questions from student. Number one, why wound healing is not occur in diabetes? The answer is due to hyperglycemia. The phagocytic activity of the macrophage become changed. The second question, professor always ask, a patient come to ward, medicine ward, and its complaint is weight loss, polydipsia, polyuria, and also abdominal pain. Why abdominal pain occur in diabetes? The answer is two. Number one, due to ischemia, due to microvascular damage in diabetes. Like in myocardial infarction, due to ischemia, pain is occur. Same in abdomen, due to neuropathy, pain occur. Number two, number one cause of pain is ischemia. Number two cause of pain is neuropathy. When nerve cell damage, also pain occur. Now after pathophysiology, types of neuropathy. There are three types of neuropathy. Number one, symmetrical peripheral neuropathy. Number two, focal and multifocal neuropathy. Number three, autonomic neuropathy. We simply remember the types by its name. Number one, symmetrical. Symmetrical mean on both sides. Number two, peripheral. Peripheral matlab peripheral neuron. Third is neuropathy. Neuropathy mean nerve damage. Symmetrical peripheral neuropathy mean peripheral neuron motor and sensory function loss. When peripheral neuron motor and sensory function loss symmetrically, this is called symmetrical peripheral neuropathy. Second type is focal and multifocal neuropathy. Focal mean at one site, and multifocal mean on many sites. Focal and multifocal neuropathy mean when one or more peripheral nerve damage or one or more cranial nerve damage. If one or more peripheral nerve damage, it is called focal and multifocal neuropathy. If one or more cranial nerve damage, mean focal and multifocal neuropathy. Mean one mean focal and more mean multifocal. The third type is autonomic neuropathy. It is shown by its name. Autonomic neuropathy mean autonomic nervous system nerve damage, and autonomic nervous system includes sympathetic and parasympathetic nervous system. When sympathetic and parasympathetic nerve damage, it is called autonomic neuropathy. There are three types of neuropathy: sympathetic, symmetrical peripheral neuropathy, second is focal and multifocal neuropathy, and third is autonomic neuropathy. Now come to the clinical feature. Now clinical feature of diabetic neuropathy. In clinic, there are 7 clinical features of diabetic neuropathy. Number one, nerve weak. When nerve become weak, there will be walking problem for patient. Number two, sole paresthesia. Number three, clinical feature is a sole ulcer. This is the sole ulcer. Look at this is the sole ulcer. This is the sole ulcer. This is the sole ulcer, and this is the sole ulcer. And why sole ulcer? Due to pressure. Because when sensory neuropathy occur, then patient is unaware due to more pressure on foot. And the fourth is abdominal pain. We already studied due to neuropathy and due to ischemia. Number 5, sex weakness occur of diabetic neuropathy patient. And 6 is diarrhea, and 7 is sweating. These are the 7 clinical features of diabetic neuropathy. Now come to the treatment. In treatment, first we do diabetic control. Number 2, we give tricyclic antidepressant because diabetic neuropathy patient take more tension, stress. Number 3, we give NSAIDs for pain. Number 4, loperamide for diarrhea, anticholinergic for sweating, and for sex weakness we give prostaglandin injections. This is the treatment of diabetic neuropathy. Now diabetic neuropathy topic become complete. We study definition, causes, pathophysiology, types, clinical feature and treatment. Now last topic is diabetic foot. We study diabetic foot in detail. In diabetic foot, topic outline include number 1 definition, number 2 causes, number 3 symptoms, number 4 treatment. First definition. What is definition of diabetic foot? Diabetic foot is a long-term complication of diabetes mellitus. What is diabetic foot? Diabetic foot is a long-term complication of diabetes mellitus. Number 2, come to the causes. There are 3 main causes of diabetic foot. Number 1, neuropathy. Number 2, peripheral microvascular disease. And number 3 is macrophage dysfunction. Now first, neuropathy. We divide neuropathy into 3. Number 1, sensory neuropathy, sympathetic neuropathy and motor neuropathy. Now come to the now we study each micropathy mechanism detail. When sensory neuropathy occur, patient foot there will be more pressure because due to sensory nerve damage patient is unaware by more pressure and in the result necrosis occur. In second, sympathetic neuropathy, because our sweat gland are controlled by sympathetic nervous system. When sympathetic nerve damage, sympathetic neuropathy, there will be less sweating, in the result dryness of foot, in the result skin rupture. The third is motor neuropathy, because our motor neurons supply muscle. When motor neuropathy occur, muscle become weak and foot shape change. This is the like that. Here the foot shape change. Why? Due to motor neuropathy. Look at this, the foot shape change. Now the second cause of diabetic foot is peripheral microvascular disease. In lower limb, due to diabetes, due to peripheral microvascular disease, due to damage of small vessel, there will be gangrene of foot. The third cause is macrophage dysfunction, like we already studied in diabetic neuropathy. Due to hyperglycemia, when glucose accumulates in macrophage, its phagocytic action will be modified. In the result will be infection. Due to infection, the diabetic foot will be developed. Now come to the symptoms. In symptoms there will be pain, paresthesia, ulcer-like. This is the ulcer, this is ulcer, this is ulcer, these are the ulcer. Pain, paresthesia, ulcer, sepsis. When infection reaches to bone, there will be osteomyelitis and gangrene. The sixth is gangrene. These are the symptoms. Last is treatment. Treatment include, first, we should keep foot clean, take NSAID for pain, wash the foot, take antibiotics for ulcer and infection, and take regular X-ray for bone involvement. And sixth is, should not keep dry. Should keep our foot wet, not dry. Now today our topic is complete of diabetic emergency, because in first video we studied diabetic ketoacidosis, in second video we studied hyperosmolar non-ketotic coma and hypoglycemic coma, in third video today we studied diabetic neuropathy and diabetic foot. Now if you like my lecture, click the like button, and if you new to the channel, subscribe my channel by pressing the red button and click the bell icon to open all notification in order to you receive my all new video. For watching my video, I am very thankful to you. Thank you very much.